Hello and welcome to Transforming Healthcare, a programme from the Association of British Health Tech Industries and ITN Productions. I'm Natasha Kaplinsky. It's estimated that 1 in 2 people in the UK will be diagnosed with cancer in their lifetime. But advances through research and technology are enabling earlier, more accurate and cost-effective detection. Helena Carter went to meet cancer diagnostic company Zilico Ltd to find out about Zscan, their diagnostic tool for cervical cancer.
Across the UK, there's brilliant work being done in the world of science. The latest developments in technology are transforming healthcare, not just in the UK, but globally. Zilico is a medical diagnostic device and surgical tools company who are addressing a clinical need in healthcare. Zscan is their flagship product within cervical cancer.
Many diseases are still visually diagnosed, and clinicians are pretty good at that. But as you're trying to prevent diseases earlier, it becomes more challenging to find disease for clinicians visually. And this is where we come in. As disease moves from normal into early precancer, late precancer, and then invasive cancer, the properties of cells and tissue change. Equally, the electrical properties of those tissue and cells changes. And you can measure that. And the way you measure that is a technique known as electrical impedance spectroscopy.
Zilico's EIS technology is proving to be hugely beneficial when it comes to the cervical screening pathway. The traditional colposcopy method hasn't significantly improved since the 1920s, but Zscan is changing this. So talk to me a little bit about the process then.
Okay, so once we've passed the speculum, we apply the acetic acid. While that's working, I use Zscan. It takes 12 measurements from around the neck of the womb. It surveys the area where the precancer may be. Well, I think as a colposcopist, if you have a second real-time test available to you, then it improves your confidence in deciding how to manage somebody. So if you're seeing a patient and you think there might be disease there, it will give you a better indication of where to take a biopsy. That means that we're detecting more disease and reassuring patients who don't have disease. That has led to us taking fewer biopsies overall.
The technology is also helping to improve the overall experience for patients in clinics across the country.
Studies have shown that women who attend colposcopy clinics for whatever reason have high levels of anxiety, and if we can minimise that, that's great for the patients, but also it's good for our clinics. The additional benefit of being able to reassure patients and discharge them quickly is that we're freeing up follow-up appointments. From our validation with Zscan, it's shown that we will reduce the number of women that we are bringing back for follow-up.
Concerning cervical cancer, Zscan picks up 14% more disease. In what is a challenging area for clinicians, low-grade referrals, Zscan detects 50% more disease early on. Treatment at first visit has increased from 37% to 68% with Zscan. The electrical impedance spectroscopy technology has been further developed for use with oral, anal and esophageal cancers, as well as to allow more accurate assessment of tissue margins during surgery, including within robotics.
In the UK, we have a particular problem with mouth cancer. It is increasing, and we need new tools to be able to diagnose it earlier. Electrical impedance spectroscopy will allow us to be able to do that without a biopsy, and so it may encourage more people to come to have their mouth assessed, and that is the key message that we really need to get across to the public in terms of being able to reduce the burden of oral cancer in our communities.
Zilico are planning for their technology and products to be used worldwide and foresee their Zscan being part of the legacy that eradicates cervical cancer.